My name is Dr. Jerry Klum. In 1975, I had the good fortune to be one of 3 faculty members that were the founding faculty of Life Chiropractic College. Life Chiropractic College has emerged and grown over the years into the largest and most extensive chiropractic institution in the world, and today we know it as Life University. For the last 30 years, I've served as president of Life Chiropractic College West in Hayward, California. In January of 2011, I retired from that position, and a few months after that, Dr. Riekman approached me about the possibility of me working with Life University to serve as the director of the Octagon. As a concept, the Octagon is intended to be a think tank for the chiropractic profession and for all people who share a vitalistic orientation to life, health, and well-being. The goal of the Octagon is to serve as a vehicle for discussion, for learning, for exchanging of ideas, and for growth and maturation of perspectives regarding health and society in general. The important emphasis of the Octagon is its vitalistic orientation, an orientation that is directed toward appreciating the inherent, inborn knowledge, capacity, and intelligence that exists in all life. It is that driving concept behind the Octagon that serves as the anchor for all of our activities. This year, in 2012, the Octagon is planning to look at a very important moment in time. Here in the United States, we are about to implement the greatest and most significant change in healthcare delivery in the history of the human race, with the implementation of the Patient Protection and Affordable Care Act of 2010. In that act, there was a great deal of emphasis placed on prevention. There was a great deal of emphasis placed on new designs and systems associated with healthcare. And the Octagon is going to focus on those perspectives. If you lived in the United States and you've worked in this environment in the past few months, you know there's a great deal of misinformation and disinformation out there about the Affordable Care Act. There's a lot of good things out there and there's a lot of bad things out there. Our goal is to separate the wheat from the chaff and to begin to understand exactly what the legislation suggests, what it implies, and what it provides for. Then what we want to do is recast the discussion of healthcare within the vitalistic framework that the Octagon is known for, and begin to imagine how we as chiropractors, along with other persons and other disciplines that share an appreciation for a vitalistic approach to healthcare, can bring those awarenesses, bring those understandings to influence the emerging system under the Patient Protection and Affordable Care Act. Think about the possibility of changing the system on a fundamental way. Can we shift out of a disease model into a health model? Can we shift out of taking care of people when they're at their worst point in time to taking care of people when they're at a good moment in time to make sure they never get to that worst moment in time? That's the challenge before us for Octagon 2012. We invite your participation. We encourage you to join us on April 12th through 14th, 2012 on the campus of Life University in Marietta, Georgia, just a few miles outside of Atlanta. And we look forward to being with you for these exciting, exciting times.